and it can cause symptoms such as diarrhea as well. So a lot of effects from alcohol. Next question, number 15. Why do some people get pancreatitis from alcohol? So there's several ways. Now, if you picture the person that has an alcoholic binge, we will sometimes see those people come into hospital with acute, what we call acute pancreatitis. Definition for that medically is image findings of your pancreas being inflamed plus your amylase level or lipase level is above 3 times the upper limit of normal. Now those things they happen when you drink alcohol, and I want to say that it's we see it commonly. It's not the most everyone that drinks heavily doesn't get pancreatitis acutely, but it is a severe risk factor and it can kill you. Very dangerous. Should be really careful about it. That's why you don't binge alcohol. And the effects can be directly on what we call the acinar cells of the pancreas, when it causes direct damage to that. And that can trigger activation of the enzymes within the pancreas rather than the intestine, leading to a massive inflammatory response. And there's lots of damage that can do. And it's a scary complication. It really is. There are other causes for pancreatitis like gallstones, high triglyceride levels, but certainly alcohol is one of them. And if you have acute pancreatitis, you're at real risk. If you get severe pain in your upper abdomen going to the back, you need to go straight to the hospital. And people stay in hospital for weeks to months. They develop complications of the pancreas cysts. We sometimes have to drain them. Sometimes that people need operations. You can get death of pancreatic necrosis and death of the pancreas. And the inflammatory response that's associated with that is immense. It's immense. And there are scoring tools for its severity, but when that inflammatory response happens, it's difficult to know whether it's difficult to control that. There have been proposed clinical trials looking at things to try and help modulate that inflammatory response, but so far I don't think we found anything massively effective, and it's generally supportive therapy. We see a lot of people go to intensive care because of that. The alcohol, it can result in thicker secretions from the pancreas, and that causes the ducts to become blocked, but also you can get calcification due to smaller episodes of pancreatitis that happen recurrently, and that can cause recurrent pain and blockage of the ducts, and they become dilated and painful. That tends to happen more with the chronic pancreatitis. So there should be a distinction between acute pancreatitis and chronic pancreatitis. I'll come on to that in a minute. But obviously the alcohol directly causes an oxidative stress as well as damage to the acinar cells. Some people are genetically more susceptible, but people who are overweight can have a higher risk, and people that smoke also have a higher risk as well. When you get damage to the pancreas, even if it's not a massive acute pancreatitis episode, we do see people who have a fatty pancreas because of risk factors, but also due to alcohol, and smaller insults that we don't tend to see in hospital necessarily, but they're getting out in the community, and they develop an atrophic, worn away, calcified pancreas, and they develop symptoms of pain recurrently. And we call that chronic pancreatitis, and you don't see the same rise in the blood levels, but that ends up causing malabsorption, increased cancer risk. The malabsorption is terrible. You can get a diarrhea that we call steatorrhea, pale stool floating in the toilet, which is essentially a demonstration of a lack of pancreatic enzymes that you need. And people often get recurrent pain, and they end up coming to hospital for it, and we put them on morphine drips sometimes to help control it. So it's a terrible complication and of drinking alcohol. And that's essentially why it occurs in a basic term. Does alcohol affect sleep quality? Absolutely. And I know a lot of people see alcohol as a sedative, have a drink, help me go to sleep at night, but it doesn't appear to help you have good sleep. It doesn't seem to help improve your REM sleep, the rapid eye movement sleep. So even though alcohol is a sedative and people get drowsy on it, it doesn't seem to help you have that good REM sleep that helps you regulate your emotions, memory, psychological recovery that you need. You don't feel refreshed after drinking alcohol. People can attest to that by hangovers, I guess. Even though hangovers are dehydration and electrolyte disturbance as well. But it's not like you feel refreshed after having binge the night before. It fragments your sleep. And it also relaxes those upper airway muscles. You get so relaxed that you can develop snoring, obstructive sleep apnea, and that can disturb your sleep as well when you get intermittent drops in oxygen saturation at night. But yeah, it's long term. People drinking in the evening, it does affect their sleep, their concentration. They end up becoming more irritable. They get dysregulation in hormone profiles because of that sleep, most likely. Cortisol levels change. They don't go up, rise, and fall when they should do. And having high cortisol levels at night are going to make you not sleep as well. So the physiological effect is quite profound with alcohol on sleep. So it's really important to realize that if you want to get to sleep, drinking a bit of alcohol is probably one of the worst things that you can do. Does alcohol cause weight gain even if I eat the same? So if you're drinking, well, if you eat the same, so if you have a glass of wine, a medium glass of wine, so there's about, I think, 7 calories per gram of alcohol. Let's say probably about 200 calories or in a beer or a glass of wine, medium to large, I suppose, 200 to 300. So if you've got 250 calories per drink, let's say, and you have a couple of drinks a night, it's already 500 calories. So people sometimes underestimate the calorie content of wine and beer. So if you're drinking that with your food, you're essentially adding calories. So yes, you will put on weight if you drink, but eat at a fixed level, if you're adding on calories. It does influence your sleep and then therefore your appetite and decision making. It has effects on those hormonal appetite signals such as ghrelin and leptin, such that your satiety mechanisms are changed. So you may also feel more hungry when you're drinking alcohol, and other hormone profiles and sleep are affected. So, you've heard about people that are binging on alcohol and they like to have a kebab with it or a burger with it, that kind of stuff. So it does seem, it is possible that it affects your appetite as well. And it will have some kind of metabolic effect as well. So if you drink alcohol, your body may sometimes switch off fat oxidation and preferentially burn the ethanol off or metabolize the ethanol off. And I guess if that happens, then you can conceivably reduce your fat burning mechanisms. That beer belly that people talk about isn't necessarily that. That could be related to cortisol imbalance, centripetal obesity, related to reduced muscle mass. So if you're drinking lots of alcohol, the other thing that people fail at doing well is building muscle, especially when you've got liver disease. In fact, there is literature to show that when people are cirrhotic and they've got very poor muscle mass, even after a transplant, it's very hard for them to build up muscle. It is incredibly difficult when you have a cirrhotic patient who's lost a lot of muscle mass to build them up in any way to get them strong enough for a liver transplant. I think I met today a young man in his 30s who's unfortunately got liver cirrhosis, and he's undergone his transplant assessment, not completely yet, he's not listed yet, but he's lost a lot of weight, and he had a lot of fatty liver and there was alcohol involved, but he has lost, 15, 20 kilograms, and a lot of that is muscle related. And I can see that even if we get into a transplant, he's probably not going to put on all that muscle again. So whether that's partly related to just alcohol and liver disease or both, it is you see people that drink a lot of alcohol become very thin in their musculature and sometimes have a pot belly. Now that pot belly, if they do not have cirrhosis, could be visceral fat. So fat stored around your organs. And that's really the worst kind of fat to have. And I'm sure you guys know that already. And that's multifactorial, metabolically related, low muscle mass related, eating the wrong kinds of food, calories from your alcohol. If you do have cirrhosis, we always look for fluid in the abdomen as well. That's a complication of liver failure. But if we're taking the non-cirrhotics, then there's a variety of mechanisms that are going to cause that beer belly, what we talk about. But generally speaking, the answer is yes, you can increase your weight. The mechanisms are through additional calories, reduced fat burning, increased appetite, ghrelin, leptin impairment, impaired sleep affects your hormones, cortisol, hunger hormones, makes you want to eat more, and you get reduction in muscle mass, reduction in your basal metabolic rate, you put on more fat. So essentially alcohol can be a potent driver of weight gain, much to the contrary of what people may believe. We do, you recognize the people that you see who are alcoholics who are very, very thin, but they often will have a bit of a beer belly and visceral fat and fat around the organs, which isn't healthy at all. That kind of weight loss through alcohol is the worst kind of weight loss that you can have, amongst some others, smoking related cachexia and what have you. But you really don't set yourself up well when you drink a lot of alcohol and you lose weight as a result of it. Are beer bellies, question 18, are beer bellies really from beer? So actually we've touched on this a little bit. So it's generally related, the beer belly phenomenon in people that drink a lot of alcohol is most likely related to the visceral fat. And it's for all those reasons that we just discussed. So you put on weight because of your calories, impaired sleep, hormone profiles, increased appetite, and all those reasons put the visceral fat on, and it starts protruding out in your belly. And this is how you spot people who have got a fatty liver, whether it's due to alcohol, whether it's due to metabolic reasons. You just need to look at people and see if their waist is a bit too much. If they've got a protruding belly, then they've probably got some degree of fatty liver. That is not to say that people who look slim are completely excluded from having a fatty liver or liver problems. There are plenty of people and plenty of literature that show that people with a BMI of 20 to 25 will also have fatty livers. In fact, those people with scarring and have a low BMI are actually one of the higher risk groups of people with fatty liver. And that's probably related to low muscle mass in some direct or indirect form. So, so beer bellies, if I was going to say beer belly is related to beer directly, then there is a phenomenon called ascites, which is fluid on the abdomen that develops in patients that have a cirrhotic liver, so end-stage scarring, and their liver is failing gradually. That term where you get the pot belly because of the fluid can be attributed potentially directly to the alcohol effect of damaging the liver. But I think what we mean is the visceral fat, really. Question number 19. Does alcohol affect the microbiome in a way that harms health? I feel like I'm asking this question again, sorry. Yes, It does. Absolutely, it does. So alcohol affects the microbiome by causing direct damage to the lining of the gut. It causes inflammation of the lining of the gut. It causes loosening of the tight junctions. It can then, as a result, cause bacterial translocation into the bloodstream, which can go to the liver. What I didn't explain was how it does that. So the gut, the intestine, it has a it 70 to 75% of the blood draining from the intestine goes to the liver via what's called the portal vein. And this is a very important vein, which we consider because it can cause complications in liver disease. But that blood is drained from the gut, goes straight to the liver. So if you're eating food and you're absorbing nutrients and proteins and glucose, that vein transports a lot of what's absorbed to the liver. And so you can imagine that if it's harmful substances, it's going to cause damage to the liver. It takes a lot of good products, but it takes a lot of harmful products as well. And the liver tends to deal with a lot of it, but when it's too much, it causes damage to the liver cells. So when you have impairment and damage of the gut lining, you're going to get that, but you're also going to get an impairment of the gut microbiome diversity. And when you have impairment of gut microbiome diversity, it can affect a lot of things. It can affect whether you develop a fatty liver. We know that from mouse and human studies. It can affect your ability to put on muscle even. It can affect your brain, your mood. It can affect your concentration. It can affect your sleep, your mental health. So the gut-brain, gut-liver axis is very important. There's, the gut-muscle axis is also very important. And so, yes, in that respect, alcohol can cause damage to the microbiome. And but there are, just cutting out alcohol is one treatment. But there are so many things you can do for your gut microbiome, which I hope to talk about. Exercise, sleep, food you eat. It's really important to have a healthy microbiome. If you don't, you can increase your risk of developing things like diabetes, insulin resistance, essentially lower long-term survival, lower your survival rates and your health span, essentially. Number 20, can cutting down alcohol improve my energy and mood, even if I don't have a problem? Yes. Do you know, this is a good question. So I see so many people, not so many as I'd like to, but you see people who give up alcohol and they didn't think it was a problem before. And it's just a revelation to them. It completely changes their life and they feel so much better for it. Some people, yeah, they put on a bit more weight actually, but there's probably some healthy weight related as well, muscle mass. But overall, people's sleep improves, their REM sleep, their good sleep improves, their mood improves, their depression that they had before goes away, their appetite's much more regulated. I do wonder whether it's not just the direct effect of not drinking alcohol, but the indirect effect of, for example, sleep. They see their liver function tests improve. That's something that may correlate with them feeling better. But they look at their blood results, because patients can see their blood results now, and they feel better about things. Maybe that's a placebo effect, but the liver function tests improve, which is important to the doctors to see. Blood pressure certainly gets better after about 4 weeks. Your blood pressure improves, especially if you're drinking more than, say 14 units above the UK recommended limit. People feel calmer, their tremors go, they're less anxious, cognitively they're more sharp, and there's a lot. Yes, there's a lot of improvement when stopping alcohol. People end up sometimes fill the void with good things. Sometimes it's eating, sometimes it's bad things, sometimes it's smoking. But overall, people who I see give up alcohol, they tend to fill the gap with quite healthy things. Actually, their relationships are better with their family and friends. they they engage. One of the things to say is, if you are drinking in excess, then it's important to engage with people, cessation services or people, because the people that I see that don't engage, they're the ones that just don't do well. They don't live as long. If you don't drink in excess and you're just trying to give up alcohol and it's not a problem for you, then it doesn't necessarily seem logical to me to have it occasionally when we know it's causing harm. If it's not that beneficial to you, then maybe just see if you can try and cut it out. And I get a lot of backlash, even from my own family, about that kind of stuff. I'm a real, as I've said before, and I'll say many times, I am not fun at a party. Don't invite me. I just spot things and I'll tell them, but I tell them out of love. I want people to feel better and live longer and be around. Anyway, I hope that was helpful. I will crack on with trying to do more videos and more AMAs, and I hope to see you in the next one. Take care.